Hi there, this is Lori Edge-Hughes, and this is your 4-Leg Rehab Minute. And in today's minute, I want to know or help you to have a plan. Do you have a plan for the rehab treatment for a dog with Chiari malformation and syringomyelia? Okay, so what are we talking about here? So the Chiari malformation is basically where we've got the heads have become squashed because, oh, isn't this cute? Okay, but basically that means that we don't have enough room at the back of the skull for the brainstem. So it can get squashed, it can push out of the brainstem can push out, and it's not good. Okay, your syringomyelia is there can be a syrinx, which is a fluid cavitation within one or multiple layers of the spinal cord segments. Okay, and all of this then causes abnormal sensory processing. Okay, and they can experience pain, be hypersensitive to touch. So some of the things that you would see with these guys, neck scratching, and usually it's just obsessive, okay, or head rubbing, sometimes tail chasing, biting, paw licking. Not that every paw licking is this, but anyways, hopping or air scratching while they're walking on lead. It's just they're walking and then essentially they get itchy. So it looks like they're starting to scratch at themselves. It may progress to low vocalization, which is a really high pitched, awful sound. It's awful. The fly catching, okay, frequent shaking, and can develop into severe pain or motor deficits. Alrighty, so medication is usually what's used to treat these guys. Surgery is done in people, but veterinary side, it's less so. And of course, if it's the syrinx, and there isn't the same amount of things that can be done surgical wise there anyways. The Chiari malformation, they might be able to open up that area, but anyways, what can you do? So these guys have a reduced exercise tolerance, okay? And or they start scratching. So part of that is going to be education, and you yourself knowing that if you're, sending these guys to the underwater treadmill, like why? So what has to be done is an education about shorter, more frequent bouts of exercise because they can't tolerate long exercise. Okay. Laser therapy, I have found this to be beneficial, and theoretically then we are decreasing inflammation, reducing pain via reducing excitability of the nerve endings and releasing of endorphins. You might be able to do sensory integration techniques because light is going to be and touchy is going to be uncomfortable. So if you do like the compression type sensory integration techniques, they might deal with that better. I will then, anyways, before I get to that part, lymphatic drainage. Now, that is light touch, but I'm wondering if we can especially do lymphatic drainage down the back of the neck and to try and aim it to our lymph nodes down in through here. Whether if there is a increase of blood flow back in there, whether that can help. Now, I'm going to say I've not tested that one, so that's just spitballing, thinking on the fly. I don't know. Acupuncture and acupoint stimulation, I think that is beneficial. What I will tell you I have tried that does not work. Massage, they don't tend to deal well with that. The one thought is, well, maybe it would work because it helps with relaxation, but if they're hypersensitive to the touch, then that's not going to work. You could try it, but know that, if they get reactive, then you don't do it. I found that they don't like craniosacral therapy either, and whether it's the light touch, whether it's just too much in and around the head, I've usually found that they either don't like it or it sets them off on scratching. Okay, same would go for myofascial release techniques. So let's say your tail pulls. Well, now we're just like pulling on our brainstem. Whoa, not going to be good. Or you know, the dura surrounding the area with the syrinx. So the tail pulls and that kind of traction doesn't seem to do well, and myofascial release doesn't seem to do well. So anyways, what we've come up with then is perhaps sensory integration, the laser, some acupuncture, acupoint stimulation, and education about exercise. So now you have a bit of a plan, and that's it. So until next time, cheers. I can't find my little button to stop.